Histology of body tubes, say the gut tube or respiratory tube or the renal tube, maybe the genital tube. These tubes, they are having one common pattern of organization of layers, like they'll have 4 layers. So what are the 4 layers generally these tubes are having? They'll have, number one, the mucosa. Under that you will have the submucosa, and over that we have the muscular externa. Muscular externa, or is also called muscular propria. And number 4, there will be outermost connective tissue adventitia, but if you are in the gut tube, then it will be the serosa, peritoneal serosa. And peritoneal serosa, we'll see that it will be mesothelium basically, which is the peritoneum, and simple squamous epithelium. So outermost could be simple squamous epithelium, and if it is not there, then we'll have what is called as the connective tissue adventitia with some neurovascular bundle. What is the importance of that? Because questions come on that. Now, there can be modification according to the location. Say for example, if we are talking about the mucosa in the gut tube, say esophagus, it will be non-keratinized stratified squamous epithelium. But if you are looking at the respiratory tube, then you will find that it will be for mucociliary clearance. So pseudo stratified ciliated columnar epithelium with goblet cells. If you are looking at the renal tube, you will find that there will be the stretchable epithelium for storage. So stretchable for storage, that is the transitional epithelium or urothelium. They have reserve cell membrane, and the epithelium can stretch to accommodate the increasing amount of urine. Now, as we are talking about submucosa, it is basically connective tissue with neurovascular bundle, and there will be some plexuses which we have to talk about. Muscular propria or muscular externa, if it is gut tube, inner circular outer longitudinal layer of smooth muscles for peristalsis. So that is one basic idea. Now let us look at some diagram and draw our own diagram. As we say, this is the body tube. It could be any body tube, say for example gut tube. There will be a lumen. Lumen will have food if it is gut tube, and it will be having air if it is respiratory tube. It will be having the genital secretion like semen if it is genital tube, or it could be renal tube, so it will have urine. So all these things can be there in the lumen, but is lined by number one mucosa. You can write here. So number one is the mucosa, number two under that is the submucosa, number three muscular propria or muscular externa, number four the serosa. But serosa, which we mentioned, peritoneal serosa, will be seen in the gut tube, not other places. In the other places, instead of serosa, will have what is called as connective tissue adventitia with the neurovascular bundle, the outermost layer. Now mucosa itself will have 3 sublayers. So what are the 3 sublayers? You can see here. Number 1 epithelium, number 2 lamina propria, number 3 muscular mucosa. It is epithelium which gives the glands, and glands will be found in the lamina propria. So number 1 epithelium, number 2 lamina propria, number 3 muscular mucosa, a thin muscle, smooth muscle in the mucosa region. So this is the mucosa divided into 3 parts. We'll draw our diagram, discuss more about that. Now, if we have talked about the mucosa, which is having this epithelium, and then you are having what is called as the glands, which are given by the epithelium. There is this lamina propria, which is the subepithelial connective tissue, and glands are in there only most of the time, though glands can extend into submucosa sometime. Like in esophagus, there can be glands in the submucosa. In the proximal duodenum, Brunner's gland is in the submucosa, but it is a rarity to see glands in the submucosa. We'll discuss about that later also. Glands should be in the lamina propria of the mucosa region, generally speaking. Now, this is the smooth muscle layer we were talking about, the smooth muscle, thin muscle layer, and this is the muscle of mucosa, so muscularis mucosa. This is about the 3 component of mucosa. Then what is there in the submucosa? You have nerve plexus, like we'll discuss. This is one nerve plexus. It is called as Meissner's plexus. So we call this as the Meissner plexus. It is helping us in increasing the secretions. The plexus which you are talking about will have ganglia, and these ganglia are parasympathetic ganglia, and parasympathetic ganglia, they use acetylcholine to increase the secretion. Similarly, there will be one more ganglia, myenteric plexus myenteric ganglia, which is called Auerbach's ganglia. This is called myenteric because it is between the muscles. We said inner circular, outer longitudinal. So between them you will have this plexus sandwich between the two, and this is to increase peristalsis. Again, it is parasympathetic system, so increase peristalsis. Where is that? You can locate it. See, this was the submucosal plexus which we were telling in the submucosa, and it is the Meissner plexus to increase the secretions under parasympathetic system, because these ganglia are parasympathetic ganglia. Then this is another ganglia which is the myenteric plexus or Auerbach's ganglia, and it is between the two layers, that is inner circular, outer longitudinal, to increase the peristalsis. See, this is the outer longitudinal muscle. In a transverse section which we are seeing here in the gut tube, it will appear like that, whereas inner is circular layer. So inner circular layer, outer longitudinal layer, this is what we are calling as the muscular externa or the muscular propria. And outside, if you look at this, this is either going to be the connective tissue adventitia or it could be serosa. Serosa means it will be peritoneal serosa lined by simple squamous epithelium, and it is seen in the gut tube because only gut tube will be lined by peritoneum. As such, if you are talking about tubes, of course, when you go into the renal tube, they are retroperitoneal most of the time. What is this? This is parasympathetic system coming from the central nervous system to stimulate the parasympathetic ganglia, but then we also have sympathetic activities. Sympathetic system is for storage. It is antagonizing the parasympathetic system. Parasympathetic system is for evacuation. So you can write that parasympathetic system, by increasing peristalsis, it is for evacuation, like bladder wobble evacuation done by parasympathetic system. Sympathetic system is S for S, storage, and it will reduce the peristalsis, basically antagonizing. So it will store the fecal matter, store the urine, basically. Now we are going to draw this diagram ourselves also. As you draw this diagram, you will tell that this is the lumen, and lumen can have anything, as we have mentioned, could be the food, or it could be the urine, it could be the semen, it could be the air. If it is respiratory tube, then you have the air. If it is genital tube, then you have the semen. If it is the renal tube, you have the urine. Food is the gut tube. Now they have similar structures, but like the air tube, respiratory tube will have additional layer of hyaline cartilage, like you will see trachea and primary bronchus. So trachea and primary bronchus will have hyaline cartilage to maintain the patency of the tube, otherwise trachea cannot collapse, the air flow will stop. So there you can have hyaline cartilage which is giving some patency to the tube. So tubes can have different modifications. Now what was lumen lined by? Lumen was lined by this mucosa. You can write lumen was lined by mucosa. Later we'll see that mucosa itself will have three components, subcomponents. Now if that is the lumen, what is deep to that? Under mucosa. Under mucosa you will have what is called as the submucosa. So this is the layer we are telling it is submucosa, which will have some connective tissue with the neurovascular bundle. What is outside that? Outside that we'll see that there is muscular externa. So this is the muscular externa. Muscular externa, we have mentioned that most of the time it will be inner circular, outer longitudinal layer, especially if you are talking about the gut tube, but then there can be exceptions, like stomach will have additional oblique muscles. So there can be additional layers also, additional oblique muscle is seen. So there are three layers now in the stomach. Otherwise, normally speaking, there should be inner circular, outer longitudinal, though the arrangement can change. And what is still outside? Still outside, we'll find that there was this layer which is called as the connective tissue adventitia, but it could be even the peritoneal serosa. Now going into further details, it will have neurovascular bundle from outside. The neurovascular bundle was inside in the submucosa, because if the gut tube is there, it will have thickness. So from the inner side you have to supply some blood vessels, and from outside also you have to supply, so that well perfusion is there. Now coming back to the lumen lined by mucosa. It will be having 3 layers. So, what are the 3 layers we have mentioned? It will be the mucosal epithelium, and which it depends. If it is the gut tube, you will have something like columnar epithelium. Columnar epithelium for secretion and absorption. If it is the respiratory tube, then the epithelium could be pseudo-stratified ciliated columnar epithelium with goblet cell for mucociliary clearance. Now, with the epithelium, under that subepithelial connective tissue is there, and subepithelial connective tissue is what is called lamina propria. LP means lamina propria. Lamina propria is subepithelial connective tissue, and it will be loose areolar connective tissue. There is loose areolar. Areola means spaces. So, loose areolar connective tissue is there, and in the lamina propria will have the glands which are made by epithelium, and it will also have the mucosa associated lymphoid tissue. So, mucosa associated lymphoid tissue is also found in the lamina propria. My point is, mucosa, first thing is you are having epithelium, it will form glands. Where the glands will be? In the lamina propria, which is subepithelial connective tissue, and there you will have the mucosa associated lymphoid tissue also. What was the third thing? It is the muscle of mucosa, which is called muscularis mucosa. So, we are telling it is the muscularis mucosa or muscle of mucosa, smooth muscle, very thin. We will see that in a diagram also. Histological diagram. This is a schematic diagram. Now, as we already have mentioned, in the submucosa will have the connective tissue and neurovascular bundle. It is very rare to see that the submucosa is having glands, but that rarity, as we have mentioned, can be esophagus. In the esophagus, we have submucosal glands, which is rarely found, and these submucosal glands can also be seen in the duodenum, and there they have a name also. It is called as Brunner's gland. Why we are focusing upon all this is because whatever we are discussing, they are already MCQs and they have a high potential of repeating themselves. So, submucosal glands are rare but can be seen in esophagus and proximal duodenum. In the submucosa. Now, in the submucosa, we had one plexus also. We were calling it as Meissner plexus. So, this Meissner plexus or Meissner ganglia, they are parasympathetic ganglia, and these parasympathetic ganglia, they are to increase the secretions like glandular secretion, having parasympathetic system, acetylcholine and secretions. In asthma, it will be hyperactivated and there will be more of secretion. That is why patient find difficulty breathing, because trachea bronchial tree is hyper responsive to parasympathetic system, more of acetylcholine, more of secretion, difficulty breathing, because if the tube is filled with a lot of secretion, there will be difficulty breathing. Now, as we move on to the other plexus, it will be in the muscular externa. So, in the muscular externa, you will have Auerbach's plexus, which is abutted between the 2 layers, because in the muscular externa you have seen there is an inner circular layer, like muscles will be like this, inner circular and outer longitudinal layer. So, as we are telling, there will be inner circular and there is outer longitudinal muscles. Abutted between them is the Auerbach's plexus. So, this is the Auerbach's plexus, and Auerbach's plexus or Auerbach's ganglia is again parasympathetic system, and it is to increase the peristalsis, to increase the evacuation. Now, what happens is there is a condition which is called as Hirschsprung disease. In Hirschsprung disease, there is congenital aganglionic megacolon. Now, why do you have congenital aganglionic megacolon? Because it is a problem of neural crest cell migration. Neural crest cell did not migrate properly. They did not reach the distal intestine, distal colon, and in the distal colon you will find, when you take a biopsy also, there are no ganglia. So, no ganglia. If you are talking about these ganglia, they were parasympathetic ganglia. Mostly Auerbach's is missing, but even the Meissner will be missing. So, these ganglia are missing. You can evaluate yourself. If these ganglia are missing, peristalsis will be missing, and if peristalsis is missing, then evacuation is missing, and that is why the patient will have meconium retention. And because there is meconium retention, constipation, the colon becomes megacolon due to lot of meconium or fecal matter inside the colon, and it is aganglionic. You have taken biopsy, no ganglia, because no neural crest cell, no ganglia, and congenital, it is since birth. All of these are MCQs. I'll repeat. When you are talking about Hirschsprung disease, which is congenital aganglionic megacolon, why it is megacolon? It is megacolon because it is having fecal matter, meconium retention. But why there is retention? Because there is no evacuation. Why there is no evacuation? Why there is no peristalsis? Because the parasympathetic system, airbags, is missing. Not only airbags is missing, Meissner is also missing. My point is, if a question comes, which plexus is missing? First answer airbags, second is Meissner, in a sequence. And why they are missing? Because parasympathetic ganglia are missing. And why they are missing? Because it is a problem of neural crest cell migration to the distal colon. You take a biopsy, rectal biopsy, no ganglia. That's why aganglionic megacolon. So that is about the organization of the body tubes, and then we continue discussing the gut tube, respiratory tube, renal tube, genital tube separately.